numbers that we have, the data that we've been able to organize and analyze so far. All over, we hear the scientists.
Have that. The next line will be the date that the various people affected. When did they report? So the date that they were seen at the facility. The next to that, which is so very close to the proxy, is the date the sample came. If you look at how Ghana started attacking the virus, waiting not to chase the virus, but then face it directly by doing enhanced contact tracing. There are a lot of people that we tested that were having symptoms. So if we are using the daily case incident with the signs and symptoms, then that will have a challenge. So clearly, the best data that we are using for this bell-shaped curve is the use of data from the date samples were tested. So where we are now, we started having a build. The first confirmed case in the country was on the 12th of March. So then those were from the people that we put together later, those that were put on quarantine. Out of the 1,030, in a short time, we had 115 of them. Those in quarantine at Accra here and also in Tamale. So you realize that with a sharp rise, and now with the cases that we are tested, clearly we seem as a country to be on top of the peak, and we are at a stage to decline. That is the observation now. The declination will depend on how we adhere to the various preventive etiquettes that have been enumerated. We are not off the hook yet. But then if we continue the way we are doing now, by adhering to the various social distancing, adhering to the various individual preventive measures, wearing of mask, keeping away a distance from others, hand washing, cough etiquettes, other respiratory etiquettes. These are the things, when we do intensively, will let us come down from where we are. So restraint direction
has to do with the
number. To the question where you are at the peak of the curve, yet to come down.